Hi, everyone. We are at the Women's 7th Annual Heart Symposium. And for those of you who were with us earlier, welcome back. And for those of you who are just joining us for this session, welcome. We have been doing this for several years now. Our initial goal was to educate the women of North Carolina, which we're still doing. And we started out with about 25 people and we've moved into over 100. And this year we're doing it by Zoom, just as COVID has affected everything. It affected our meeting. We will be happy to still provide everybody with our 7th Annual Women's Heart t-shirt. So I hope you can wear it with pride. And tell all your friends to come next year. Please remember to use the Q&A for questions that you might have, and also just to be aware that if we have your email, we can always give you a heads up for the next meeting. We're very blessed today to have Dr. Leslie Davis and Chiao-Hsin Teng with us. Leslie and I have known each other for way longer than I care to admit. We've been all different kinds of settings, but she is now a professor in the School of Nursing, and I'm very proud to be associated with another woman who is so passionate about heart disease in women. And I'm sure her friend and graduate student is as well. So I'm going to say that for this year, my year was hard, just because learning to adapt to cardiology with COVID and pandemic. So I'm curious to hear what Dr. Davis and Chiao-Hsin have to say about that. But here, with no further ado, Leslie and Chiao-Hsin.
So first of all, I'm pleased to be here. I've been in person for this event for several years, so it's sort of nice to reach more people that might not have been able to come in person, but I do miss seeing the smiling faces and seeing everyone in person. I usually wear red and like go red for women and red for heart. But today I decided, because of the UNC Health Foundation and all of you at Carolina, I wanted to wear a little Carolina blue. I'm an alum ×4 and been teaching at the university for over 20 years before my PhD. And then I'm a part-time nurse practitioner in cardiology now on Fridays with hypertension, high blood pressure. But I'm just thrilled to be here. The last year has been challenging because we weren't able to see as many people in person, but I'm so delighted we could see our patients by telehealth. But my student here, Chiao-Hsin Teng, is a PhD student who's pretty much completed her coursework, getting ready to start a dissertation with stroke survivors. So I'll let she'll tell a little bit about herself, but I've been so disappointed that we can't see each other weekly in person. So we've done a lot of time on Zoom, but I'm such a people person. I'm such a hugger. Even I've been known to hug some patients. So that's been difficult during COVID. But I'm just so thrilled to be with you here. We're here with you today. I'll let Chiao-Hsin say hello, and then I'll pull up my slides and we'll get started.
Hi, everybody. I'm Chao Xing. I'm the second year PhD student at UNC School of Nursing. Overall, I'm interested in the stroke survivors' tightness after having a stroke. So although during the pandemic this year has been challenging, that I still feel great. I'm still grateful that I feel safe and healthy, and I can do my research in the right publication. Have been very productive with working with Dr. Davis. Thank you.
All right, I'm going to get started. I'm going to pull up our slides. And somebody give me the thumbs up that we can see them, right, Chiao-Hsin? She's used to giving me a thumbs up if you can see the slides. Yes, and what I'll do, I do want folks from afar, I can't see all you, but somehow just send your positive thoughts and love towards Chiao-Hsin, because being here, she's from Taiwan and she hasn't been able to go home last summer from her family and her loved ones. So from afar, we just want to express our support, and I'm so glad she could be with us today. So what I'm going to share with you today is the talk is really about how to recognize and the importance of reporting heart symptoms if you think you're having a heart attack, whether you've been a history of having a heart attack in the past or future. But I would love for Allison to launch a poll, because I'm really curious who we've got in the audience. So if you can see here, I have two questions. The first one is, have you ever been told you have had a heart attack, or that you've had angina or angina, depending on where you're from, like tomato or tomato. But have you ever been told you've had a heart attack or that you have angina? So it's coming in. We'll give it a few more seconds, but I'm seeing that majority have never been told they've had a heart attack or have angina. So that will help me frame my remarks. Let's move on to the second question. Okay. If you were to have symptoms that you believe are heart related before my talk, do you have an action plan that you would follow? You might not have even thought about that, but if you've ever thought about what would happen if I had symptoms that I believe are heart related or a heart attack, do you know what to do? Do you have a plan? Okay, about 60%, or a little over half, say they have a plan. About 1 in 5 said no plan, and about 1 in 4 said unsure. Okay, that's all of our polling questions, because that will help me a little bit know my audience, because it's we can take down the polling questions. Allison, I'll stop that. There we go. So I'm going to talk to you about how to recognize and how to report heart symptoms. You might think, why in the world does she need to tell us how to report heart symptoms? Well, that's part of the plan. And you'll see that I've written the word rehearse here, but we're, and at the end of the talk, Chiao-Hsin's going to share something, how exciting we're doing a research study, and if it's successful, how we would launch it into regular clinical practice. But we really want women, and I'm talking about women's heart symptoms here, but the same would be for men, that there's really skills related to, you have to know, but what the symptoms are, but the skills of how to recognize heart symptoms and who and when you should report things to. And so we came up with a long thing that the abbreviation stands for rehearse, because we like women to rehearse these things, especially if they've had a recent heart attack. And I'll go into that a little more. So the first thing is the typical heart attack symptoms, or the typical symptoms of a heart attack. And even though in the hospital, the clinicians, we might call it myocardial infarction or acute coronary syndrome, the lay people and the persons that I talk to all the time, we just call it a heart attack symptoms. Now, you may think, just like we see in the movies a little bit, that everybody has chest pain. It's not always the Hollywood heart attack, quote unquote, that you see where someone collapses. That, in fact, that's usually like a cardiac arrest. But we talk to people, and I tell men and women, it may be chest pressure, it may be tightness, it may be crushing, it may be squeezing. And you see that little image to the right there. It looks like a little robot where the yellow is sort of in the center of the chest. But there's also, and I'm going to talk to you in just a second, that symptoms could go up your neck or down your left arm. And so those are the classic symptoms. And I would say like 9 out of 10 men would have those classic symptoms, something really in the chest area, but maybe only 2 out of 3 or 3 out of 4 women might have those. So majority of those that have a heart attack will have something in that chest area, but not all. And some studies have shown up to 1 in 3 people don't have any heart attack symptoms, that you actually could have what's called like a silent heart attack. And we would pick that up later if we were doing an EKG or some echocardiogram, like an ultrasound of your heart. For another reason, we might be doing it, and we would pick up maybe there was an old heart attack that maybe you didn't know you had. Okay, so this is something that actually comes from the CDC, heart disease. Believe it or not, they do more than just COVID these days. But signs of a heart attack, and this was something, and I've had women that have had previous heart attacks, and they argue with this, about this picture with me, so I'll share. But they say there's sort of 5 groups of major signs and symptoms of a heart attack in men and women. And the first thing is, we do think about chest pain or discomfort, that number 1, and it shows the front there in the dress, or the one on the right in pants, so to speak, that it might be in the chest where it's on the front, or it could go through your body almost to the upper back. But really the chest pain or discomfort is the first thing that a lot of people think about. Also, especially in women and those that are older or those that may have diabetes, it may be a nausea feeling or a feeling of lightheadedness or unusually tired or fatigued. Now that number 2 in this image, they'll put more so in women and they put it at the top of the head. Now I've had women say, well, they should put that near your stomach if you're feeling wheezy, but it's just trying to show you a figure of these. Number 3, especially in women, but men can have it, pain or discomfort in the jaw, neck, or upper back. It's usually not lower back. Number 4, the other group of symptoms people may have are pain or discomfort in the arm or shoulder. Typically, it is in the left arm, but I have talked to women that have had heart attacks where it goes down their right arm. And everything about their symptoms they thought was a heart attack, but because it was in their right arm and not their left, they stayed at home a lot longer before they told somebody. So even though it's usually in the left arm, if it goes down your arm, keep in mind that just because it's in the opposite arm doesn't mean it's not a heart attack. And then shortness of breath. That's a very common sign or symptom of a heart attack. And it may be, all of these may be related to something else, but that could be in people that don't have chest pain, that they may have the shortness of breath. And you may say, well, sometimes I feel tired all the time. These symptoms need to represent something different than your usual, what we call different from baseline. Now, in the next thing, it's like, well, what are other symptoms if it's not the chest pain or pressure or tightness? Some people talk about like it's sort of a like a heartburn. So some people don't have those classic chest pain or chest pressure symptoms. So what we watch for is a shortness of breath. And again, these things would be different than your usual. And we call it something like the angina equivalent, that they don't have the typical, and some people don't like to use the word typical, but the classic symptoms of chest pain or pressure. But in women or those that are older or those that have diabetes, it may be the shortness of breath. It may be nausea, vomiting, or heartburn, and that be the only symptom, but it would be very different. I have one woman that had a heart attack in one of my studies that she shared it was heartburn. She was in her 70s, and this was something like when she was in her 20s when she was pregnant, but not quite that. So she remembered that far back of having it that way, but it wasn't like that. So it wasn't the average indigestion after some tomato sauce. It was something clearly different. Sweating all of a sudden. Now in the health field, we call it diaphoresis, but it's where you totally break out in a sweat, unexplained. And it usually would be accompanied with like the shortness of breath, but something like that. Palpitations are what we call where your heart races or beats out of your chest that would be highly unusual, not just because I ran after something in the street or ran up some steps. I'm sure some of you will feel your heartbeat faster, but it would be something unusual. Anxiety or lightheadedness that's unusual. Passing out may be the sign or symptom. And once in a while, somebody will describe something like a feeling of impending doom. Now, I typically think of other things. We think of blood clots in the lungs and different things in the health field when we hear about that. But if somebody really feels this doom that they've never felt before, that may be related. Now, again, if all you had was nausea and that was it, and it wasn't that different in the world, that's probably not a heart attack. It would be something highly unusual. Now, next, I do teach women. We teach a lot of what I'm going to teach today with you with like an hour-long session of women that have had heart attacks. We try and teach them within about 7 to 10 days after their hospital discharge after a heart attack, so they'd recognize future heart attacks. But we also teach them what would be symptoms of a stroke. If you have a history of a heart attack, then you're potentially at risk for a stroke. Say usually that happens like a decade later, but we do need to know there is a difference between a heart attack and stroke. Personally, if you have any of these, I'd rather you go in the hospital and not try and figure out, is this heart attack or is this stroke? But there are those that believe we should know the difference. So we do review when I talk to women in the hospital or in the clinic or those that are in our research studies, that a stroke is different. A stroke is different, and these posters you'll see on billboards in various places, or you might get this on a poster in a clinic. But to spot a stroke, if you look to the left, that somebody's balance might be off, or their eyes might have blurred vision more than normal. A big thing about their face, one side might be drooping. I tell folks to make funny faces in the mirror, and if one side clearly doesn't look like the other when you puff your cheeks or smile, that could be a stroke. The arms, the difference here is it would be like a tingling on one side or paralysis where you can't move it. Now, sometimes women that have heart attacks, men and women, they'll talk about that left arm is more like a numbness or tingling than it is pain. So that doesn't make it heart attack versus stroke, but that could relate to either one if it's numb or tingling while you're having those other symptoms. Slurred speech with a stroke. Now, some people that sometimes stay home a little too long and they could have benefited from having treatment if they'd have come in sooner will explain to me the slurred speech was sort of like somebody was talking with toothpaste in their mouth and it wasn't that bad, so they waited a while. Well, don't wait if it's something that's not usual. A severe headache, now that can happen a lot of times, but it would be like the worst headache of your life. All right, we also teach what's not a heart attack. Now, probably there's one person in the world that's had a cough during a heart attack, so I'm not saying it could never be, but chances are if it's a lot related to a cough, that's not the typical way you would have a heart attack. If it's abdominal pain that's sort of below your belly button, that's not usually a heart attack. Diarrhea or constipation is not really a heart attack. Now, did someone ever have diarrhea during a heart attack? Sure, because heart attacks take a few hours to happen, but it's not typically a heart attack. And when people describe symptoms where it's like a ice pick or a needle going into their chest just for a few seconds, that's not a heart attack or stroke. All right, so what we do talk to people about now, Chiao-Hsin's going to explain that we do teaching. She and I do teaching where we meet women in the hospital or in their homes within about a week or so after a heart attack. And we teach them after they've had a heart attack, and that's not most of you. But once you've been diagnosed with angina or a heart attack, we teach you what would be your stable angina versus what could be a heart attack, because you don't go in for everything. So if you've never been diagnosed with a heart attack or angina, we want to know about what I have on the screen. But if you're a known heart patient, if symptoms are what's listed on here, this is called stable angina, and you don't necessarily need to call somebody. You can just wait until your next appointment. But if you're a known heart patient and physical activities such as exercise or heavy work or weather extremes or something highly emotional brings on any of those symptoms I've just talked about that could be like a heart attack. If you know what brings them on, when I walk to the mailbox on a 100-degree day in July, I have a little angina. And you sit down and rest or take one nitroglycerin, as long as it's prescribed to you, don't take a family member's, and it's gone in 5 minutes. That's stable angina in someone with a history of angina. So that we don't want you to call in every time. You can, of course, always have a conversation with your clinician, but that's stable angina, that's predictable. If that starts happening every day and it used to only happen every 6 months, that a change in pattern we'd want to know about. What we want to know about right away is if you've never been diagnosed with a heart attack or angina, if something is new or something has changed, if you have a history of stable angina, if stuff's happening new ever, or if you have a history of it and it's more frequent or lasts longer, seems to be getting progressive, more intense, more severe, or now it's waking you up at rest, or it occurs during rest, watching TV or just sitting at a table. This is different, or it's less predictable. Or normally you might have just a little chest tightness, rest or nitroglycerin makes it go away, but now you're having those other symptoms along with the chest tightness, what we call more associated symptoms. Doesn't go away with 5 minutes of rest or one nitroglycerin. This could be what we call unstable angina. It doesn't mean your vital signs are unstable. It just means this could be a warning sign of a heart attack. This typically happens about 7 to 10 days before a heart attack in about 2/3 of patients, men or women. So this is a time where you really need to communicate with someone. And if it goes away, but this is happening and changing, call your healthcare provider to get seen sooner rather than later. All right, now if you're having an acute heart attack, and a lot of people don't have any symptoms until the day they have a heart attack. you may have these warning signs 7 to 10 days before the heart attack, but a lot of people don't have symptoms until the day of the heart attack. And that's because a lot of blockage takes years to happen. And a heart attack can occur with any of those vessels 50% or more blocked. And a heart attack, you know, you don't usually have symptoms till it's either 50 or 60 or 70% blocked. So that's common that it may be your heart attack is the first time you have symptoms. So we're going to prevent it. There's a lot of good talks today about how to prevent it. In this case, the symptoms don't totally go away. Some stay at a same intense level. Some come and go intermittently, especially with women. In all our research in the last decade, we do research with women and heart attacks. About half describe where it comes and goes. And they didn't think it was a heart attack because they could continue cooking, or they can continue working, or continue writing that paper or that grant, or teaching a class. So they thought it couldn't have been a heart attack because I could keep doing what I was doing. Well, not necessarily. Typically, a heart attack is more than just one symptom. And if you've had a history of heart disease and you normally take nitro, this time nitro is not letting it go away. So how are men and women different? And Chiao-Hsin found this beautiful picture for our slides to say, well, we're different for many reasons, but the symptoms are different. So women in general have a lot more where you're more likely to have back and neck, upper back, neck, jaw pain, nausea or vomiting. I've already mentioned it. Maybe a loss of appetite, shortness of breath, palpitations, that heart racing, unusual fatigue or dizziness. How bad or severe your chest pain or other symptoms really don't mean it's not a heart attack. So the point is, sometimes women especially don't have quote unquote severe symptoms. That's why I explained that you may be able to continue doing what you're doing. And many will tell me, about half of the women that have heart attacks, well, I didn't think it was a heart attack because I didn't pass out. That's just not necessarily going to happen with every woman. All right, so if you're a heart attack survivor, I know that's not a lot of people in this audience that answered the poll, keep in mind you're not cured. About 1 in 5 that have a heart attack, when they're discharged from the hospital, they'll have another heart attack in the next year. They think because the symptoms have gone away that they're cured and it's not coming back, but it could come back. And what we do is we really double down to try and prevent it and work with your healthcare team and go to cardiac rehab to learn how to prevent, but also how to recognize future heart symptoms. And what I've learned in the last 20 years, talking to a lot of women that have heart attack, is sometimes the symptoms are different with the future heart attack. Probably most of the symptoms are similar, but if 1 or 2 symptoms are slightly different, don't let it keep you at home because you can't figure it out. So what we get women, right before I transition to Chiao-Hsin, we get women to watch for symptoms. We give them a symptom checklist, very much of what I've just shared with you. We teach them that if a pattern changes, to connect the dots that the pattern is changing, so you need to tell someone. If the pattern is changing, but yet it still goes away, then call your outpatient provider, your team, Dr. Miller, if she's your provider, or Julie Lewis, the nurse practitioner that works with her. If you're having symptoms and you've never had a heart attack, so you don't have nitroglycerin and it's lasting more than 5 minutes, you need to call 911 if you believe it's heart related. And don't be afraid to do that. They can get you to the hospital and do an EKG on the way to the hospital. So if it is a heart attack, that shows you to open that vessel, and that will help your heart not sustain as much damage, because a heart attack takes a few hours, more than a few hours to happen. But the sooner we open that vessel in the cath lab, the less damage you would have. And sometimes, as I said, if you're having the symptoms, they go away, but it's a change, then you call your outpatient and make that appointment like the next day. All right, I'm going to pass it on to Chiao-Hsin, and she's going to tell you how we're converting our face-to-face education to something that we're doing online in our next research study. Go ahead, Chiao-Hsin.
Okay, I'm very excited to share our program with y'all. So this is a research study for women with a recent heart attack, and then we create a website to help women recognize their symptoms and monitoring those symptoms. So basically, after they leave the hospital, within 7 to 10 days, we will schedule an online session with our participant for 1 hour. And we will teach them what kind of symptoms to watch for after having a heart attack, and how to schedule, how to do the daily symptom monitoring, and how to use their personalized action plan, and how to better communicate with the healthcare team if the symptom return or symptoms has a big change. So at the right hand side, this is our landing page of our website. So once the participant logging in the website, they can see their names on it. And they have some few functions like go to diary, review some action plan, or you can review your symptom summary, and you can also rewatch the teaching sessions. Please go on to the next page. So the first function is to let the participant fill in the daily diary. So the figure in the middle of the slide is how the diary looks like. Overall, we will let participant fill in whether they have some heart-related symptoms. For example, the chest pressure, arm pain, or the nausea. So how severe the symptoms are, how long the symptoms last, and how often the symptoms occur. Is that serious? Or based on these symptoms, did you take any actions? Like, did you tell someone, or did you take any nitroglycerin after to release your symptoms? And after they filled out the daily diary day by day, when they click on the feedback button, there is a symptom summary shows up. And we have some interesting traffic sign on our figure. So it is kind of to cue them to do some actions. For example, if a participant sees a stop sign on their figure, it is kind of telling them that, okay, stop. This is a big change for your symptoms compare your previous symptoms. So you probably need to do something. Probably need to figure out what is going on for now. Or you can also print it out for your summary, symptom summary, to bring it to the clinic and to talk it through with your healthcare providers. So this is additional advantage for our symptom summary. Okay, next page. So we will also provide the action plan, and basically this is the action plan is help participants to go through each step when they have a big change for their symptoms. And the action plan is personalized because based on each woman's health condition, some women can take the nitroglycerin to release some symptoms, but some can't. So the interventionist will provide the personalized action plan for them. And the action plan is very flexible. It can be viewed on any devices like a phone, computer, or tablet. Once they log in the website, they can see it 24 hours, 7 days. And we also will provide the hard copy or the magnet that can be available for at their place. And we also will provide some scripts for them to better communicate with others, like if there is a big change for their symptoms, if they really need to call 911, what is the important information they need to tell? And if they need to schedule an appointment, what kind of information the health provider might need to know. And I think the last thing I would like to share is that this program will be launched in this summer. I'm very excited about it, and it is totally free. And if this research study goes well, we hope to apply this intervention to real clinical care. Thank you. And now we move to, I guess we move to the Q&A section, and please feel free to ask some questions.
Yeah. Oh gosh, where did you guys go? I lost you. Thanks so much, you guys. That was very good information. There have been some questions. One is if you have a history of heart palpitations and tachycardia due to SVT, especially related to severe stress, how do you know the difference between that and a heart attack? Would it be if the med taken for tachycardia episodes doesn't, or what would it be if the meds didn't work for the tachycardia? But again, the main question is relation between the palpitations.
So that question came up. I'll think of a real woman that I talked to, because over the years I've interviewed a lot of women during clinical care, but also part of research studies where we interview about symptoms.
I think we're losing you, Leslie, on your audio.
And it is common for like, so Paula, do you want to answer that question, and I'll switch to a hotspot? I'm sorry.
Oh no, that's fine. The one was about palpitations.
Yes, can you hear me now? And I'll switch.
Yeah, oh, we can hear you now. Yeah, now we can hear you.
So if we freeze up again, I'll switch. But basically, if women have a history of like atrial fibrillation and they've never had a heart attack or angina, and the usual things don't work, then consider that it could be a heart attack. Once they've had a heart attack, if they have had a heart attack and they have a history of atrial fibrillation, we teach them to first think, if you've already had a history of a heart attack and palpitations, then first try your nitroglycerin for your heart attack, because that's the most emergent thing. And if the nitroglycerin makes it go away, then you know it was angina and not a heart attack. But if all you've had is a history of palpitations, do your usual path of what you normally have been told about your palpitations. But if it's something different about your palpitations, that could be something new. I hope that made sense, that it matters whether you've had a history of a heart attack. If you've had a history of a heart attack and you have both conditions, in your action plan, you're first going to take your nitroglycerin and rest. But if you've never had a heart attack and you have your usual palpitations, just handle it the usual way you do it. What you're looking for is a change. That is this now a heart attack more than my usual palpitations? Does that make sense?
Yeah. So palpitations by themselves, generally, if you've been worked up and your doctor has told you that yes, these are premature atrial beats or premature ventricular beats, those by themselves, like Dr. Davis said, are usually not associated with an ongoing heart attack. But if you've had a heart attack in the past and those have been your symptoms, then that's when you want to pay more attention to it. Most of the time, PACs and PVCs or SVT, all the little names for them, are mostly not related to occlusive coronary disease or blocks in your arteries. There's another question, Leslie, and I'd be happy to hear what you had to say. With so much biotech available, such as 40 exercise watches and other health and cardiovascular monitoring / reporting devices, would a wearable be a good idea for certain people at risk or just increase anxiety?
So we have not created an app for a wearable for our intervention that we're doing with education and helping people monitor symptoms, because what I would do now is just keep a diary at the end of the day if you've had a history of a heart attack, whether you had any symptoms or not, so that when you go see your healthcare team, you can share with them your symptoms. And what we're creating is an online way to do that so that we can pick up on pattern changes. Wearables, in my mind, and I'll be open to what you say, are if you're tracking some physical activity, they motivate me to do more. Although during COVID, I'll be honest that all the wearables are off and I'm eating ice cream. But so what I would want you to monitor if you're at risk for a heart attack or have had a history is, are your symptoms, have you had symptoms? Are you concerned? Take notes in a diary. There's nothing I would want you wearable to connecting that. If we
Yeah.
create an app later from our diaries and it's more convenient to do that, we really want them to do it at the end of the day or the next morning, because in real time, if you have symptoms, I don't want you fiddling with anything. I would rather you take care of yourself.
Yeah, I mean, I think from a prevention standpoint, the people that I suggest get wearables or that have wearables, and they're really great for tracking activity level, what your heart rate does, trying to get, if you want to do a more conditioning program, they're going to help you with that because you can see your target. You can see when you reach your target rate when you're exercising. More along the lines of not diagnostic, but information that's good in creating good cardiovascular health, not diagnosing something.
I
They're
would
good
say
for
one
people
other
that live
thing.
alone if they have falls, because the new ones will like send a message if you fall down and don't get up. But
I would love for people that have high blood pressure, because on Fridays I volunteer in the high blood pressure clinic. I would love for them, there's not a wearable now to take your blood pressure, but if you had something every morning where you'd enter your blood pressure, where you take it from your cuff, or if there's something that keeps up with knowing your numbers and helping prevent stuff like
yeah,
that.
that's my lecture tomorrow, is know your numbers.
Know your numbers.
Know
For
your
sure.
numbers. And I do want to stress that what's been said in the last two sessions was that women tend to not to think about their symptoms a little longer. I think we show up about an hour later in the emergency room for our first heart attack than men, because we're trying to figure out who's going to feed the dog, or who's going to take care of the house, or who's going to, before we're like, oh gosh, maybe I should go get this checked out. So we need to do, Leslie and I are both doing, and Chiao-Hsin are doing education. And I think that is the way that we make people healthier, is educate and prevent.
So Paula, I'll make one comment about that. Research does show for over 25 years, men and women take about 2 to 3 hours to get to the hospital once a heart attack stops. And the one thing that women could do differently, women on average, it takes them an extra half hour before they ever tell anyone about the symptoms. If you do nothing else, tell someone else, family or stranger, about your symptoms. Research will show if you get somebody involved, because we want to keep it to ourselves, we don't want to be trouble. It's for many reasons we keep it to ourselves. But if you will tell someone, and actually if you tell a stranger, you're more likely to go in faster. If you tell a family member, they may try and reassure you, you'll be okay, go take a nap. But I'd rather, if research will show, if you do that one action first to tell someone, you're more likely to get into the hospital, to get care sooner, and to live longer.
That's the important one. That's a whole nother, going to cardiac rehab, learning about your heart after a heart attack.
And that's the other thing. Only 1 in 5 go to cardiac rehab. So if the second, we don't have a lot of time, but if that, you will double down, you will live longer. Research shows, that, Paula. That
absolutely. And we work really hard on getting people there. Well, thank you guys for participating in our symposium. Hopefully we can get you back next year, and maybe we'll be in person.
And I encourage everyone to come back next year in person, because once you're part of the club, you need to bring a friend.
It is fun to be in person and see people, but at least we can get the information out this way. The Medical Foundation has been absolutely wonderful in helping put this together. And I do want to remind everybody that it's always been free, and in my mind, it will always be free. I want people to be able to access information with no strings attached.
Absolutely.
And just try to make healthier decisions. So I want to thank everybody who came, and there is another set of sessions tomorrow, so we hope to see people there. And Brian, I'm going to turn it over to you.
Thank you, Dr. Miller, Dr. Davis, and Chiao-Hsin. Thank you so much for that great information. It's just so important for all of our participants and all the women out there to know the differences and the subtle signs that many times we don't realize. But I wanted to reiterate from Dr. Miller's last statements is that here's some resources that you see on there that we will be sending all this information to everyone who's registered for this webinar today. So you don't need to worry about writing all this down. You'll receive an email early next week that will contain these links as well as the PowerPoints that you that were shared today. And you will have access to this recorded webinar. So those are things that you'll be receiving early next week. I did want to make sure that sign up for tomorrow. If you, like Dr. Miller was talking about, tomorrow, know your stats. That's something that is so important. So got plenty of time. We have 4 more sessions tomorrow. I encourage you to go to the registration page that you can find via the email that you registered from previously. If you would like to sign up some more of those, and we'll get you all set on that. And as Dr. Miller said, the Division of Cardiology and UNC Health has really been back this effort by Dr. Miller for many years, and we wish to continue to do so. But we have had really generous donations, contributions from grateful patients and friends in the community to help continue to expand this effort, and that's something we would love to do. If you would be interested in learning more about how you can help Dr. Miller in this effort, please reach out to me. I'd love to share more information with you and just discuss what that might look like. This is just amazing work, and just so proud to be a part of it. Have a great day. And the last thing, you'll get in a survey pretty soon here. It's really short, 1 to 2 minutes. Please take time to fill that out. That will help us with the future programming, and also anything that you'd like to know more about from today. So have a great afternoon, and we thank you so much, and hopefully we'll see you tomorrow.